Vodafone cares about you and your health. Through our 255 call center, we have empowered Ghanaians from across the country with our unique phone-in medical consultancy. We also bring you Health Fest, where a trained medical team travel the nation giving free medical treatment. But it all started here on your TV screen with the award-winning television program, Healthline. This week on Vodafone Healthline,
did you know there was a way you could actually see your heart beating inside your body?
In the field,
if it's a benign lesion, she has a very good prognosis. But if it's a malignant one, the patient might need more treatment after the surgery.
Hello and welcome to Vodafone Healthline, where we empower you with the knowledge to take on your health challenges. I'm Papani and I'm here with...
Hello, my name is Ruth.
I'm Lorraine.
And hello, I'm Bright.
HealthCam sets the ball rolling.
Thank you for that all-important question, because when it comes to the benefits and the importance of taking water that is wholesome and free of any contaminants, the benefits and the essence of it cannot be overemphasized. When it comes to water, the source of your water is very important. Now, the danger of this is that there are so many diseases that are associated with taking water that's contaminated. The number one symptom you get is diarrhea. I mean, life-threatening, not just any, I went a couple of times a day. This is life-threatening diarrhea from 5 to 15 times a day. And then it may be associated with abdominal pain and cramping. So these diarrheal diseases, I mean, we've all heard of cholera. We've all heard of something we call typhoid, the all-famous typhoid. There are other diseases like dysentery, amoebiasis. These are all big names for diseases that we get from taking water that is contaminated.
If you have water at home through the tap, ideally that should be clean enough. But not every water available to you is really wholesome for drinking. So you're better off trying to purify your own water just to make sure it's safe. And a very, very easy way to do it is through boiling. Okay, you can boil your water and after that you can strain, or you can strain it to remove the big particles and then you boil. Other people try to chlorinate. They put some chlorine in it, or alum, which is readily available on the market. But you cannot definitely tell me you don't have firewood or a means of cooking. Definitely you can boil your water. And if you should do this, I'm sure that you can avoid drinking unsafe water and contracting some of these unhealthy diseases.
So like they say, where there is doubt, there's no doubt. If you're not certain about the safety of your water, use some of these things to actually try and sterilize and purify your water.
We take a question from the audience.
Hello, doctors. My name is Bright. Please, I do not hear much of HIV lately. Is it no longer a threat?
Wow, Bright, I wish that was true. But the truth is, HIV is still very much around. So you can still contract HIV. And the truth is, a lot of people who have a disease are not labeled. You would not be able to tell that they have the disease condition because the disease has a very long latent phase before it begins to show itself. So it's important that you still stick to the ABCs that we know about. That is, A, you need to abstain. If you're not ready for sexual activity, abstain. And B, you need to be faithful to your partner. Stick to one partner. And C, if you need to do it, please, you need to use a condom. So yes, HIV is still around. It's very much a threat, but you can protect yourself from it. Learn how some simple medical knowledge can help someone out. I read is at it again.
No, I'm not a doctor, but with first aid, I can help. First aid for unconsciousness. This may be caused by a blow to the head or chest, a drug overdose, severe blood loss, or alcohol poisoning. My friend here had a blow to the head. Check for any danger to you or the patient and make the area safe. Now follow these 5 steps. Response. Check for response by asking a simple question and grasp or squeeze the shoulders. Send for help. Call for an ambulance or send someone else to call. Airway. Open the airway by tilting the head back and lifting the chin. Breathing. Check for normal breathing, CPR, and perform chest compressions and breaths. So you see, it's not really rocket science now, is it?
Vodafone, power to you.
Did you know there was a way you could actually see your heart beating inside your body without having to open your chest? There's something called an echocardiogram, and today we're going to see how it functions.
Healthline would like to thank Impact Medical and Diagnostics in Asylum Down for the use of their facilities.
We're here today with Dr. Martin Eduadade, a cardiologist, to tell us all about echocardiograms. Doc, you're welcome.
Thank you.
So doctor, tell us exactly what is an echocardiogram?
Aside the echocardiogram, probably the only way to see the heart in motion is to split the chest open and then physically look at it. But with this new ultrasound technology, you are able to send images into the chest and it hits the heart and is reflected back into the machine. And the machine with this computer system will reconstruct the heart.
Let's go see in real time how an echocardiogram functions.
So, Papani, we had the opportunity to image your heart and see how your heart is functioning. Okay. So this technology is allowing us to see your heart without doing an open heart surgery. And on this image, you can see that you've got a very beautiful heart here. It has 4 chambers, okay? So the left side of the heart, the right side of the heart, and this thing that you see flipping up and down is actually the valve. And you can see me move this color box from left to right and then to see whether any of the valves are leaking, and it's beautiful. There's no leakage in your valve.
Thank you, doctor. So you see, my heart is good. But what about you? If you've been asked to do an echocardiogram, please don't be afraid. You see, nothing happened to me. So it's your turn now. On this segment, we talk about health issues that concern your child. Today, we're talking about cerebral palsy.
So cerebral palsy basically is just a condition that affects the brain of children usually before the age of 5 years. And normally it is due to a one-time damage to the brain. The damage is non-progressive and is irreversible. Mainly it presents with disorders with function of the muscles, or what we call motor function. So you may find them either with what we call spasticity. That means the muscles are very, very tense and taut in one place, so they can't easily move, the joints and the muscles, or it's very, very flaccid, as in it is so weak, so they don't have any power in their legs or arms. So people like that may have difficulty walking, okay? In some people, it may also be associated with difficulty with the muscles involved in swallowing, and that may have feeding challenges, okay? Associated with cerebral palsy is that most of the time the damage that is in the brain that is causing problem to movement also may affect ability to speak. It may also affect their intelligence. So about 66% of cases of cerebral palsy are associated with learning disability or cognitive impairment, okay? You may also find out that people who have cerebral palsy tend to have seizures, unprovoked seizures, for which they may need to be put on medication for life.
There are some causes that are actually associated with cerebral palsy. For instance, rubella is actually known to cause severe birth defects in babies. Again, in some difficult deliveries, the baby can sometimes be deprived of oxygen before being delivered, and the lack of oxygen to the brain can result in insult or injury to the brain. Now, when the baby is born, in some cases, the baby sustains some injury to the head, and this can also affect the brain and result in cerebral palsy. Some children also, when born, can actually suffer meningitis. And therefore, when they have meningitis, even after treatment, the brain could have suffered some injury, and therefore this can also affect them. And jaundice. So if the level of jaundice is too high and stays too long, this can actually affect the brain and result in cerebral palsy.
When it comes to the treatment of cerebral palsy, we say it's multimodal, in that it needs so many facets of medical practice. You may not be able to treat it, but you could take many steps to improve the quality of life of your child who suffers cerebral palsy. So we would institute the help of a speech therapist, a physiotherapist, and then you might also have what we call a neuropediatrician. So that's a pediatrician who is specialized in, brain and nerve abnormalities or dysfunction, because they tend to have delayed developmental milestones. So you expect them to sit at a certain time, and sometimes way past a year, past that day, they've not even learned to sit. But gradually we can train them to, attain these milestones. So it takes a lot of patience, and you need a very good support system at home. So you may need extra hands at home. You may need some people who are specially trained to help you take care of children with such special needs.
So now you know, cerebral palsy is permanent and irreversible and has certain debilitating effects on your child. However, there's so much you can actually do to improve the quality of life of your child and still have a healthy, happy family and healthy, happy child. Know the truth about the stories you hear every day. Time to bust some myths. And we have a question from the audience.
Hello, doctors. I'm Kekeli. How true is the saying that if you pluck one gray hair, you get several more as replacements?
So, Kekeli, I've actually heard this before. I know Lauren too has heard it before, haven't you?
The common one.
Exactly, because we're talking about it just before the show, And really, there's no truth to this at all. At all. Most of the time, when your hair falls out, it either falls out with the root of the hair. That's the whole follicle is out. And when the whole follicle is out, it's out. There's nothing that grows from there again. However, if for some reason, maybe the end of the hair follicle comes out, so the root is still there, that can grow back, okay? But not other ones surrounding it. I suppose people probably discover it because they go on an expedition and then they find one gray hair and another one somewhere. Eventually, all of us will gray, some earlier than others. In fact, we black people tend to gray later on compared to the Caucasians, but eventually everyone's hair is going to turn white. By age 50, I can assure you a significant proportion of your hair will be gray.
And the interesting thing about graying is it's a transition. So you may pluck one out today and then gradually in a few days start seeing more. But it's not that because you plucked one out, more are coming. But it's just that your hair is transitioning from one color to the other. It's a myth. There's absolutely no truth to it.
The following segment contains material of an adult nature. Viewer discretion is advised.
Let's talk sex.
Okay, so we have an SMS. I don't know why they always don't have names when it comes to sex talk, but this person says, I've heard that once you get used to a vibrator, your body stops responding to the real thing. Is this the case?
Vibrators are actually known to give you stronger orgasms, and this is achieved actually faster and quite easier. Because here's the case, it's able to give you direct stimulation to the main aspect of the vagina, which is the clitoris. So obviously, if a lady is using a vibrator most of the time, she may actually get used to the fact that this is actually giving her the pleasure she wants easy and quickly, as opposed to the actual sexual intercourse, which on a good day she gets an orgasm, probably most days she doesn't get it. So there's the risks that it may probably tend to substitute the actual thing, or probably the lady will actually go in for the actual sex, then probably go into the bathroom and use it behind her partner's back. So yes, sometimes it can cause an effect on the normal sexual intercourse that a couple should have.
See, the thing about it is that you could get so used to using the vibrator. There are different kinds of vibrators around. So you could get used to the one that really works for you. And because you feel it's giving you the necessary outcomes that you desire, you think your man can't give it to you. The problem is, it's possible you're not communicating with your partner enough. There may be something he needs to do to help you get you that arousal that you need. So you'll notice that after a while, once you're able to get good communication with your partner and he's able to address those concerns, you realize that all of a sudden the vibrator is only there to assist and augment something that's really good when you do it with a real person. You hear?
She faced many challenges because of a tumor that disfigured her face. Let's look back on Veronica's story from last season and catch up with her a year on.
Veronica's condition is a tumor which is involving the left part of the face, going into what we call the ethmoid sinus and then the frontal sinus, a little bit encroaching into the eye.
Doa dokument liaba mahofa blave vo en eko nyeba ngochi pleva jetutu ngochi pleva tu nyema ga kona to ngochi amu aba fa tona afi ngochi aba no eko nana dorafia vichukui de manya vamu manana ka womna muta nya nyema kweba enya nwa avalulu kanmako evalulu kaka vanya nga Obazba mabakwide konji afi batoto ba globu yo mata wogo tanyima ko ikolibu afi yema wila kolibu kapu mama wo operation afu ma ujo abon vivi na mafi makowe ta ayo gava yoga ma nyima fa kpoga nyima gava nya makagba igemeleba na ga kpedanwu edolele ekplon vata ayi mawe a mono jogbo vivi dam kono dazram kakale ko ga gbovano avu plechi tonta anaba nyimaga na madro jogwara ta jogwara ko chinanyi na mawom da shade ekunya ha mkola mananama tanye pla estronye ya nava afi agiafia adolela ba totrok bota yo no mo operation gbanto adolela ba totrok bota ata ushi jogbonye ni menya afika ulo abafove akata menya afiko
When I'm at first, every year I'm back as some tenants in our assassin because one person increase payment because me buy now me say my clear home na
Fia no ya wokake ya dokumedogo ikaka magbo wokake debe muda ta ashima mavano mumlumle kofoto yo kanu kwa agbave umlo na ashama no mumu.
Having spotted it the first time around the Medina market, yeah, Vero has become a friend. Then I started asking her questions pertaining to what the growth on her face is all about. And she started giving me the background history about it.
Makonye fa anya okataji dani amama bla anno wawe dinashinam gado mafi nya makpona ngudunalo na tada jinya wawe kpana da unya kaka koda vinya fa school nya ji ha wawe nya meikaw tan kpana da unya fi maglobe nya ha metan kpona nguduna vinya ba school fees nya ha mkhane afi da chinanyi etam gava kpani.
Even with the situation, she tries as much as possible to get to the market. At least let me be able to do something for myself, not necessarily depending on arms or saying that, no, let people help me, no. So she's very hardworking and respectful. That's how I see her.
Maybe like a bit more. So I'm between this. No, almost one a khaki intention. No, or you're not. Opejani ni no onyasho mo ni pe obi beka se o mi ba oko on ba bi o na obi su o no se wa boti enya hu ni se o se o mi ba oko on ba bi o mu na mpese obi mu na mo hwe ni sa obi mu na no ma ye o mi nim some stars bi ba siname
kaka na bin de vida binya poko de via jevovom menya ba mi ya ilan kuma na ma yevom de via la anya natama bubu na marake bubu karuma ngira kama no na homo fanavi because nama donku garama vai jia Atana jinya papa ba. Egbanye hanye pon kuma ba la different. Evana papa. Dana na mabuna tamanyira kama no na nyi buna tamachodo kunye usugmonto.
The following scenes contain images that could disturb sensitive viewers. Viewer discretion is advised.
Anyi jijoganda nambe nyaha magatrwa no dokinye shi abale kamala chana nyamaganya americana amukpoma wanu vovom dem alona amukpoma wanya shishi dada no mu nyaha magano abale kamala chana anyi jijoganda nampa.
What we're going to do is approach the tumor by making an incision around the nose, and then having done that, we'll open up into the middle part of the face and then take it out gradually to the posterior extent of the lesion. We may have to extend it a little bit into the forehead region so that we can address that bit of the lesion which is in the frontal sinus. After having taken it out, we may have to repair the face, but we are hoping we will get by without doing any extensive plastic reconstruction. Technically, I think it went well, but the tissues look more malignant, but the histology will give us a better picture, and then we'll work with what will come out of that. If it's a benign lesion, she has a very good prognosis. But if it's a malignant one, the patient might need more treatment after the surgery.
Please let's welcome Veronica and her son Ishmael into the studio. Veronica, Ishmael, Akwaba. Yeah. Auntie Vero, yeah, surgery you afiaba with afidi and chamber. Now me person use as she say nyama mutu saying.
She say me nyama ni nyina akosu, mi juma musu mi fie no ni nyina bibia akosu kama.
Na busanfo ne namfofo eden amaka.
Obia o meni agi say misu my free area bim.
Na Auntie Vero, mitimo se plaster bi taro han na doctor for eden amaka fa ho.
Say ekro ni nyina nyankoi. Aka kitiwa bi. Nti mi ko check appointment bia mo si ebeko ampa so sisi anu de aka no kitiwa bi.
Sir. We dey danyame asepa. This is the bibia are okay?
Nyanka sampo mi kase mitisa ye me yada. Wala for them. Me down ma se papa. Me down ma se nyanku po be shira adwuma we so e be koso akoso because adi we omo ye ma me makuma tom ye papa.
All too soon, we bring the curtain down on this week's episode. Until then, keep smiling and lead a happy life. Goodbye.
If you have been moved by the stories or issues you've seen on Healthline, you can donate 1 Ghana cedi by texting GIVE to 133. If you want to donate more than 1 Ghana cedi, please dial *133# and follow the prompts. Next week on Vodafone Healthline, our doctors talk about blood. In the field, we meet Robert, whose future is in danger.
Vodafone, power to you.